Hello, I'm Dr. Rajiv Agarwal, Professor of Medicine, Indiana University School of Medicine, Indianapolis, Indiana. If you are newly diagnosed with type 2 diabetes, the goals of care are quit smoking, watch your waistline, and increase your activity level to at least 10,000 steps per day. In addition, the hemoglobin A1C to less than 8% for sure and lower for some people, and dietary sodium content of less than 1.5 grams sodium, the LDL target is less than 100 milligrams per deciliter, preferably with a statin, and if you have hypertension and albuminuria, then treatment is with ACE inhibitor or angiotensin receptor blocker. People who have chronic kidney disease or heart failure, a new class of drug called SGLT2 inhibitors can reduce the rate of progression of kidney disease and cardiovascular disease. And now, pending approval by FDA, we might have a new option. The mineralocorticoid receptor, or MR, has been known for a long time, and its pathological activation in patients with type 2 diabetes and CKD might provoke inflammation in the heart and the kidneys. Finerenone belongs to a new class of drugs called NSMRA, or non-steroidal mineralocorticoid receptor antagonists. Dr. George Batras, professor of medicine at University of Chicago, and his colleagues reported the Fidelio-DKD trial in the New England Journal of Medicine that the drug was effective for reducing kidney failure outcomes and cardiovascular events in over 5,700 patients with chronic kidney disease and type 2 diabetes. 29 patients need to be treated to prevent one kidney failure outcome versus 42 patients to prevent one cardiovascular event. The major side effect was hyperkalemia. Now, it is well recognized that MR blockade can cause hyperkalemia. Overall, hyperkalemia seen in this trial was 18.3% in patients who are treated with finerenone and 9% in those treated with placebo. These are percent of people who had even just one episode of high potassium. The number of patients who died or hospitalized or permanently discontinued the drug because of hyperkalemia is more clinically relevant. No patient died because of hyperkalemia, few were hospitalized, and only 2.3% of the patients discontinued the study drug permanently because of hyperkalemia compared to 0.9% in the placebo group. Therefore, 71 patients need to be treated for a median of 2.6 years to have one patient permanently discontinue the drug because of hyperkalemia. For sure, we need to monitor potassium carefully, but recognize that the drug can be used safely if we do so. In my opinion, finerenone is therefore an important discovery for the treatment of people with chronic kidney disease and diabetes. Thank you for your attention.